Hi everyone, it's Miss Schumann again, and today we're going to be talking about safety in medication administration and error reduction. So when we talk about safety in medication administration, it's everyone's responsibility for the reduction of medication errors and to also monitor the adverse events related to dosing of medication errors. Causes of medication error. That's not the result of poor quality staff. Error-prone processes can be involved in the medication use system, and that can contribute to errors. And even know that excellent, well-trained, experienced practitioners can make medication errors. So when you graduate the nursing program and you take the NCLEX, when you pass NCLEX, that deems you safe by the state that you are capable of taking care of patients and administering medication. So when we talk about error-prone processes, we're talking about the misspelling of a word, the misplacement of a decimal, something like that that can cause an error, not identifying the patient properly. Those are things in the process that can cause an error. And like I said, even experienced practitioners can make a mistake. So yes, a doctor can be writing an order and the medication may come in 100 milligrams, and that may be a standard dose, but he may write 10 or 1,000 milligrams, and the nurse gives it. Well, that's an error on both of their parts. So you have to look at the system before you start to place judgment on just one person for a single error. So what are some of the causes of medication errors? Well, it can be the wrong IV fluid or the wrong medication, the incorrect dose, or even the IV rate, the wrong client, route, or time the medication's given, administration of an allergy-inducing medication, omission of a dose or given an extra dose, incorrect discontinuation of a medication or an IV fluid, inaccurate prescribing, and inadvertently giving a medication that has a similar name. So these are just some examples of medication errors that can occur. So it's really important that you always double check and triple check your medication, your dosage, your patient, your order. You have to be very diligent when it comes to the medication administration process. So if by chance a medication is given in error, the first thing you must do is observe the patient. Observe the patient. Take vital signs, but mostly you need to observe the patient because you have to have data to give to the physician whenever you call them because the patient has received medication in error. So know that oftentimes when a medication is given in error, harm may not come to the patient. So most medication errors do not result in patient harm. Some medication errors result in catastrophic harm or death. So you have high risk with high alert drugs. These drugs are highly toxic or drugs with narrow therapeutic range and have a high risk of causing devastating injury or death. So just to give you some examples, giving heparin. So heparin is one of those medications that you have to monitor closely for that therapeutic range. Giving too much heparin can be very devastating, can even cause the patient to bleed out and death. So you just have to really be mindful when you're given a drug like heparin. Another medication that I've seen that resulted in a catastrophic harm, but it really resulted in death of the patient, was IVP medication. The patient went down to have a radiology procedure, and they ended up having an allergic reaction to some dye that was given that caused them to go into cardiac arrest, and that resulted in their death. But just know that there are some medications that have that potential to cause death or injury. But for the most part, medication errors do not result in patient harm. So patient safety efforts are in place to decrease medication errors. So we have to be aware of those high alert medications. There are certain abbreviations that are prone to cause error. There are also some symbols and dose designations, such as your commas and decimals. There are also some very confusing drug names. So they may sound alike, but they're not spelled alike. So we look at those type of things when we're given medication and make sure that we have the correct medication at all times. So when we talk about high alert medications, and these are medications that can cause significant patient harm, fentanyl, which is a narcotic, an opioid, is one of those high alert medications. So whenever you administer fentanyl, it's your responsibility to know if you're giving it IV, how fast you're going to push it. It's your responsibility to know what adverse effects to look for, such as decreased respiratory rate, decreased level of consciousness, bradycardia. What are you going to look for when you are administering this medication? What is an adverse effect that may be signs that your patient is experiencing harm from this dosage administration? So the next few slides that you're going to see are just some examples of error-prone abbreviations, symbols, and dose designations, such as do not use trailing zeros. Always put a 0 in front of the decimal, as you see here with the right 0.3 milligrams. Do not put a period after abbreviations or a comma. That can cause an error. Be sure to write out micrograms or write out mcg. And use milliliter instead of cc, because that can easily be confused. Whenever you're writing something like heparin, make sure that you're writing it correctly. Put your comma in there so that you have a designation of that 5,000. You actually know it. And if you have to write out something in millions, make sure you write out the word millions instead of just units. So be very careful whenever you're using medication abbreviations and symbols that it's not going to cause any confusion or cause the person administering the drug to administer the wrong dosage. Some medications can have some very confusing names. They are written very similar or spoken very similar. They sound alike, look alike. Medications is what we can refer to them as. So it's very important that we look at medications and get corrections in spelling if you're unsure. So here is an example of what we're talking about when we talk about sound alike, look alike medications. The one on the left is Novolog. The one on the right is Novolin. You see they're the same type of mixture, 70-30, but they both have distinctly different names and they both perform differently. It is insulin, and so they both have different types of peak reactions for the patient. So you have to be very careful. Make sure you choose the correct drug with your sound alike, look alike medications. So tall man lettering is the use of mixed case letters, a mixture of both upper and lower case. We do that in drugs that names are very similar, and whenever you speak them and when you write them, they're very similar in nature. So we try to use some tall man lettering to so that you can see the difference between these drugs. And here are just some examples of tall man lettering, and you will see this on the drug packaging before you give it. When you pull it for administration, you're going to see these tall men letters on medications. So we have what's called black box warnings, and these are warnings on the packaging. And this means that the drug has a potential for a life-threatening or can cause a serious disability when given. So you have to be very mindful when you're giving a drug if there is a black box warning associated with it. So here is a couple of examples of what a black box warning label looks like. As you see, the levothyroxine or the Synthroid says not for obesity or weight loss. Another of the labels up there says warning increased mortality in elderly patients with dementia related to psychosis. So you want to avoid giving that medication. The other box says may cause dizziness. So this is what a black box warning label looks like. So the black box advises the client that there's some potential risk with the medication. It also alerts the healthcare professional, which is the nurse, about some serious side effects that could be related to that. So it just is an alerting system that there's a potential reaction or a harmful effect that can be associated with this medication. So the nurse is central to ensuring safety in medication administration by implementing safe practices. And this includes consistently and properly using technology, interpreting and transcribing the medication orders, also following the rights of medication administration, and also understanding the routes of administration. The use of electronic physician's orders and medical records has definitely decreased the number of medication errors. But it is important as the nurse that you understand all of the parts of the medication order. So this is an example of a medication order in an electronic form. As you see, there's a category, an order, a date and time, status, and stop. You also see at the bottom, you can read along, it says review, order, document, and sign. To the right, you'll see a list of things such as allergies, hold, resume, discontinue, reconcile medications, transfer, discharge. So this is just one example of electronic documentation, and it's going to look differently at different facilities. So not every facility's medication record is going to look exactly the same. But it does have the patient's name, their date of birth, their medical record number, the name of the medication, the dosage of the medication, route and frequency of the medication. If there's any component that's missing, it's your responsibility to question that order and get it corrected. Always verify your orders. Compare your MAR, which is your medication administration record, with the physician's order. And if you're using an electronic medical record, look at the physician's order and what's in the MAR summary, and check for any errors. Always double check the orders whenever you're looking at the different components, and make sure all of the components of the medication order is there. So as you see, the nurses are going to have a lot of responsibility. As the nurse, it's your responsibility to know the laws of the state in which you live. You have to know the facility policy for medication administration. You have to know how to prepare, administer the medication, and what response you're looking for. You have to keep up to date on the knowledge of the medications that you're given. You have to maintain skills and competencies. And you have to know if a medication is prescribed accurately. So once you give medications frequently, you learn some of their routine or standard doses. So it becomes a little more easier for you to see when something's abnormally written in the physician's order. But these are just some things that the nurse has to be responsible for. As nurses, we're also responsible for the safeguarding and storing of medications. We also have to follow the legal mandates when administering controlled substances, and I'm talking about narcotics and opioids. You are responsible for accurate dose calculation. When in doubt, get another nurse to check a calculation behind you, especially if it is a medication that has potential to cause great harm to your patient. You also have to know and understand the responsibilities of the other members of the healthcare team as well, such as the pharmacy tech. What is the pharmacy tech's responsibility? Where their responsibility may be putting the correct medication into the correct drawer in the medication cabinet. So it's easy to put the wrong medication in the wrong drawer. When you get to the hospital or to the nursing home and you see how medications are laid out in these drawers, you can see how easy it would be to make a medication error. So yes, we have to know that who's part of our healthcare team: the pharmacist, the pharmacy tech, the physician, the nurse who's given the medication, the secretary who's taken the orders off. We have to know everyone's responsibility and what role they play whenever we are given medications. There are 10 rights of medication administration: the right patient, right dose, right route, right time, right drug, right documentation, right education, right to refuse, right data collection, and right evaluation. As nurses, we have to follow these rights of medication administration to ensure that we do not create or make a medication error. So let's start with right client. Joint Commission requires we have 2 patient identifiers. This can be the name, an assigned number, phone number, birthday, photo ID, or a person-specific identifier. We also use ID bands. Some ID bands have barcode scanning capability because we use a barcode scanner in some facilities. And when we talk about using an identification band, always remember to put an allergy band on your patient. If they have some sort of allergy, you need to make sure they have an allergy band as well as that identification band. So the right medication. It's important that you administer the correct medication. You need to be prepared to look at that label, compare it to your MAR at least 3 times. Whenever you remove the medication from the container, look at your label. Before you put your medication into the medicine cup or draw it up into the syringe, you're going to look at the label again. When you get to the patient's bedside, before you administer that drug, before you give that pill, you're going to look at that label again. Every time you look at that label, be sure to refer back to your MAR. It's essential that you get the correct medication. Remember when we talked about tall man lettering and medications that look alike and sound alike? Doing this 3-step check ensures that you are given the proper medication to the correct patient. So now let's talk about right dose. Did you calculate the drug correctly? Do you have the correct unit dosage? Do you need a second nurse to verify that calculation? If you do, ask. Never be afraid to ask for someone else's input when it comes to dose calculation. Refer to your drug reference. if you need some more assistance in knowing if you've got the correct dosage. And always use standard measuring devices, such as a measuring cup that has the milliliters. Always make sure you have the appropriate size syringe as well. Right time. Always make sure that you're giving the medication at the right time. When you're in the hospital and you're in practice on the floor, you have an hour before or an hour after to give medications before the scheduled time. However, on NCLEX, when you take your NCLEX or any form of testing, they give you a 30-minute schedule, 30 minutes before and 30 minutes after to give your medication. That's per NCLEX standards. So make sure that the medication, if it's given at 9 a.m., that's what time you give it. If it's given at 2 p.m., that's what time you give it. Always look and see what time the medication is needed. If it is a stat medication or a give now medication, that means that you need to stop whatever you're doing and give that patient that medication at that time. So now we're going to talk about the correct route, the right route. Select the correct preparation for the route prescribed. If you have a sublingual medication prescribed, that has to be given sublingual. A sublingual medication cannot be swallowed, nor can it be crushed and placed through a feeding tube. Always use different syringes for your enteral or parenteral medications. That's your tube feedings or your IV and IM medications. Know the scope of practice for the practical nurse outlined in the State Nurse Practice Act regarding specific classifications of medications and routes of administration. For instance, in the state of Georgia, LPNs do not give IV conscious sedation, and this includes medications such as IV Versed or fentanyl during a conscious sedation procedure such as a colonoscopy or a bronchoscopy. Know how to administer medication safely and correctly. So it's up to you as the nurse to look at your drug reference to know how fast you're going to push that IV medication. You're going to also have to make sure that you understand if you can give that medication PO with food or not. So whenever you know the route that you're going to administer it, you also have to know those additional information as well. Rights 6 and 7, right documentation and right client education. With right documentation, it's important that you are documenting that you're giving the patient pain medication, the location of the pain, the intensity of the pain, the quality of the pain, the patient's follow-up response after they have received their pain medication. You're going to go back and reevaluate them in maybe 30 minutes and find out what their pain level is then, and you have to document that response. Right client education, that has to be individual to that specific client. They need to know the name of the medication that they're going to take, the purpose of the medication. For example, are they taking it for their blood pressure? Are they taking it for their heart rate? Are they taking it for an infection? You're also going to explain to the patient the expectations. They need to know that this is going to bring down your blood pressure. This is going to slow down your heart rate. This is going to clear up that infection you have in your chest, that pneumonia. It's going to get rid of that. How to take the medication. Can they take the medication with food? Is it required on an empty stomach? Is it an injection? Do they need to rotate those injection sites? Explain to the patient how they're going to take it. And then what to report. Are there any certain side effects or adverse reactions that you want the patient to report? This is all part of the client education. Rights 8 and 9. Right to refuse, right data collection. So you have to respect a patient's right to refuse to take a medication. But as the nurse, it's your responsibility to explain the consequences of failure to take that medication. For instance, a patient decides they don't want to take their blood pressure medicine. Well, then it's your job to tell them, if you don't take your blood pressure medication, there's a possibility that you could have a stroke. Those kind of things can happen when you don't take your blood pressure medication. But if a patient refuses to take their medication, you just document that patient's refusal and let the physician know. The right data collection before and after. So if you're going to give someone pain medication, what data do you need before you give it? What data do you need after you administer it? That's what we're talking about when we talk about right data collection. So you would need the location of the pain, and then you would need if the patient had pain relief. So that's the kind of data that you need. And once you get that data, make sure you document it. And last is 10, right evaluation. We talk about right evaluation. We're talking about therapeutic effects, side effects, and adverse effects. If there are any associated with that drug, make sure that you do the right evaluation and document your findings. This is just a table that shows the route of administration and drug administration, PO, buccal, sublingual, and then you have your injection sites. So this is just a quick, brief table showing that information. Here's just another table with some more of the routes of administration that you are familiar with. We've talked about this in the last session that we had. So there's a lot of information that's included in a drug label. The name, strength and form of the medication, the route, any of those alert and warnings, those black box warning labels, whether it's a single dose or a multiple use dose vial, storage information. Does this have to be stored in the refrigerator or can it be at room temperature? Also the manufacturer and the lot number of the medication. So this is an example of a prescription, and what you may see on a prescription, like on a bottle. You see the physician's name, the pharmacy where it was filled, the number of tablets dispensed, the name of the drug, the frequency, the route of administration. You also see a barcode on the side there that can be used. So there's just a lot of components in a prescription label. So there are several different ways that a medication prescription and or order can be written. So you have a routine or standard order. This would be something that the patient takes on a daily basis. For example, they may take their insulin every day on a daily basis. So it's ordered routine or standard. You have a single or one-time dose medication, which could be a now administration of a medication, or the doctor may just write one-time dose. Stat means right now. Doesn't mean an hour from now. It means right now. You have to drop whatever you're doing to give that stat medication. PRN means as needed, and it's given on a frequency. For example, Tylenol 650 milligrams given every 6 hours for temperature greater than 102. Or Tylenol 650 milligrams given every 6 hours for a headache on a scale of 2 to 5. So your PRN medication has a dose and a frequency attached to it as well. A standing order is something that is always in place. It's in a group of orders, say for an admission of a patient with chest pain. There are certain medications that are going to be routine and standing whenever that patient's admitted that you don't have to call the doctor for. It's the same way if a patient's admitted newly to a long-term care facility like a nursing home, there's some routine or standing orders in place. Those standing orders are there so that you don't have to call the doctor for that Tylenol order or that milk of magnesia order. That order is already in place for that patient. So you have names of the drug, you have generic or universal names, brand names, trade names. Some of the names, especially the trade names, are followed by the symbol R with a circle around it. But there are just several different ways that medications are named. So you need to be familiar with the brand name, generic name, or the trade name of the medication. And you're going to hear some things used interchangeably, and they often are used interchangeably. So the dosage strength is made up of two parts. You have the strength of the medication with the unit of measure, the number of capsules, tablets, or milliliters, etc., whether it's a solid oral form or the specific volume of a liquid that contains the strength of the medication. You'll see all this on the label for the drug, and that's the drug strength. Sometimes you may have more than one dose strength on a label. For example, on this bottle, this is a 4 milliliter bottle. In that 4 milliliters, you have 12 milligrams. So for each milliliter, there is 3 milligrams. So you can look at this and do your dosage calculation by using either the 12 milligrams per 4 or the 3 milligrams per 1 to do your calculation. So when we talk about dosage administration, there may be some wording that you're going to see, such as usual dose, dosage as and use, indication and use, dosage and administration, etc. So usual dosage, it indicates the typical dose that is normally prescribed to treat a particular disorder or disease. So know that some medications have multiple uses. So some blood pressure medication may be also used to treat migraine headaches. So make sure that you're looking and seeing what that patient is being prescribed the medication for so that you can see the usual dosage for that disorder. So know that the route of administration is written in various places on the drug label. So you may have to do a little bit of searching on the label to find where the route of administration is written. If it's a tablet, pill, or capsule, it may not say oral. That is just something that's going to be understood because of the type of dosage that it is. So take, for instance, this drug label. This medication can be given sub-Q, subcutaneously, IM, or IV. So you have 3 routes of administration on this drug label. So we have already talked about the black box warning. Always know that you can look at the manufacturer's insert for further information about the black box warning. So when we talk about controlled substances, we're referring to narcotics. So with narcotics, you have an ingoing and outgoing shift of nurses. They have to count the number of narcotics that are available to them, whether it's in the narcotic box or in the AccuDose, but that has to be counted at the beginning of it and the end of each shift. If there's any discrepancy with the count, if the count is off, then all of the staff has to be, you pull all the staff together and you try to resolve the problem and see if you can find, well, maybe someone just missed signing out the dose or they didn't sign it out correctly, and you can resolve it pretty quickly that way. If you find a broken vial or damaged vial, you need to notify the pharmacy immediately. If it's during the night, you have to notify the supervisor. If there's a broken vial of morphine or fentanyl in the cart, because that needs to be accounted for correctly. If you were going to give half of a narcotic, you need to have another nurse has to witness the disposal of that unused narcotic, whether it's down the sink or in the sharps container, but you have to have a witness to that unused narcotic and the disposal of that. So while we're talking about narcotics, we also need to address drug classifications or categories that are safe in pregnancy. So the drugs rate from A to X. Know that X are the most harmful drugs and they should not be taken during pregnancy due to the fetal abnormalities that they can cause, while your A drugs are very safe and a pregnant woman can take them without any difficulty. So for a controlled substance, you see the C with the 2 in the center of it there, the Roman numeral 2 by the morphine. This is your category and your class. This is what it looks like on the label. Single versus multi-dose medications. So on the vial, it will say single or multi-use. Once you have that single-use medication, you're going to withdraw the amount that you need to give. Once you do that, you have to discard that medication. As you see with this vial of adenosine, this is a single dose medication. So you may only give 3. So here is an example of a multi-dose vial. So when you have a multi-dose vial, it may contain a preservative. With a multi-dose vial, you can give more than 1 dose out of that. But you need to make sure that you label it with the date, time that you opened it so that you know how long it can stay open. Because some medications may be able to be accessed for 1 week or 30 days or even 24 hours. So you have to be mindful of how long that medication can stay open. Storage and expiration date are often on your label. So for example, on this one, it says discard unused portion after 2 weeks. And you see it can be stored in the powder form below 86 degrees. So that information you'll find on your label. Some other information you may find may be wording such as total amount, which could be tablets or milliliters. You may also see the lot number, which you have to document the lot number. If you're giving something like a flu vaccine or pneumonia vaccine, you have to document that lot number. And that can be found on the label as well. So here's an example of the manufacturer, the lot number, and the total number of tablets in the prescription or the bottle. So there are 5 steps to the medication administration process. Step number 1, the medication is ordered by the physician, nurse practitioner, or the physician's assistant. The second, the medication order is interpreted by the nurse, the pharmacist tech. Next, the order is transcribed as written, and it's either written into a paper MAR or it's transcribed into a computer or digital system. Next, you prepare the medication, and then the 5th step is the administration of the medication. And that's it for this pharmacology lecture. So, positive minds, positive vibes, and positive life. Keep up the great work.